About to tell you.
Thank you.
I wanted
Okay,
to give it a little bit of time for people to come in.
okay, thanks. Well, I was looking at you and I remembered. Okay, so here's our agenda. We'll do a quick round of introductions, very quick. But let us know, particularly if you are in these 6 county communities, because we definitely want to give you priority in this conversation, in this planning conversation. And then Joseph Hill, who is the project manager of this grant. And I will try to give you a quick background to the grant, what it's all about. But the meat of the time we want to spend together is for you to help us plan these community conversations. First thing is how many, when and where. But then the most important thing probably are the critical questions. What do we want to learn from these community conversations? If we get to this, can we have some facilitation support? Talk about who we need to invite to these conversations, and then who can actually help us host the event. These are going to be in person, so I will be down there, but of course, it will be extremely helpful to have someone who's there all the time to help us put these conversations, to host the conversations. And then I'm very sure we will need a couple more planning meetings and anything else that comes up in the course of this meeting. We want to be sure and note so that we can address it. So how does that sound for an agenda? Anybody? Comments? Yeah. Okay, great. Any other suggestions? Okay, excellent. Okay, great. Well, I am going to stop sharing so we can see each other. And let's do a quick round of introductions. So I'll start with us. I'm Wendy Winnemute with the New Mexico Alliance of Health Councils, and I should change my name here, which I'll do in a minute, and Share New Mexico. And Alex, why don't you introduce yourself?
Hello, everybody. My name is Alex Alexander Paz, and I'm a intern with the New Mexico Highlands.
Okay, and let's pass it off to, let's see, Chris, you're next on my screen.
Hi, everyone. Some of you know me, some of you don't. I'm Christine Hollis. I'm a health equity specialist with the New Mexico Department of Health. I generally serve more the metro area, but I am also, I noticed Jessica's not on the line yet. I hope she will, but with Jessica Osenbruga, I'm one of the co-chairs of the Community Engagement Committee or work group in the New Mexico Social Determinants of Health Collaborative.
Right, and we'll tell you more about that a little later. Elijah, you're next on my list, on my screen.
Hello, my name is Elijah Jaramillo. I am born and raised in Albuquerque. I'm a Buqueño at heart. I just have to say that because I'm proud of it. And I work for the New Mexico Coalition to End Homelessness. So thank you all for inviting me.
Glad to have you. Roseanne.
Hi, good morning, Wendy. Good morning, everyone. My name is Roseanne Vasquez. I'm a project manager with FYI Plus in Las Cruces and also the LC3 Behavioral Health Collaborative Coordinator. Happy to be here today.
Great, happy to have you. Amy.
Sorry about that. I should have unmuted earlier. I'm Amy Howdicke. I live in Silver City, New Mexico, and I'm a semi-retired nurse who was pretty active as a school nurse getting school-based health centers started. So I'm just now, since my retirement, getting kind of back into the groove of community health, but now with a passion for senior services in Grant County. So I've been invited to participate from our health council, and I'm just trying to get back into the loop because homelessness and many other health issues affect seniors as well. And so that is why I'm here.
Great, happy to have you. Jen.
Thanks.
Jen.
Hi, I'm Jen Gruger. I am the Quality Programs Manager for Gerald Champion Regional Medical Center in Alamogordo, and I oversee our Community Health Worker Program, also a member of the Social Determinants of Health Collaborative, member of the Health Council here, and 100% Otero.
Great, thank you. Valerie.
Good morning, all. My name is Valerie Kling, and I am a program specialist 2 in Grant County working for CHI, and I am the project coordinator for the Grant County Community Health Council and the Youth Substance Awareness and Prevention Coalition. Good to be here.
Nice to have you. Mary.
Good morning, everyone. My name is Mary Mackey. I'm Health Promotion Specialist with Department of Health here in Luna County.
And Rebecca.
Hi everyone, I'm Rebecca. I'm with the New Mexico Alliance of Health Councils. I am the only one of us that lives in the southwest part of the state. So I am seeing which ways I can help with this Southwest Coalition.
Right. Phoebe.
Hey, good morning. My name is Phoebe Schrader, and I am the Health Promotion Specialist for both Grant and Hidalgo County.
Excellent. Thank you for coming. Joseph, our leader.
Good morning, everyone, and happy Tuesday. I'm Joseph Hill. I'm the Director of Prevention and Community Collaborations for the Center for Health Innovation. Very glad to be with all today.
And Jessica.
Good morning, everyone. I'm Jessica Osenbruga. I'm the Community Initiatives Manager for the Health and Wellness Program at Roadrunner Food Bank of New Mexico. I'm also on the board, Vice Chair of the Health Equity Council for Bernalillo County. I also co-chair the Community Engagement Work Group with Chris Hollis through the New Mexico Social Determinants of Health Collaborative. Nice to see everyone.
Yeah. Sharon Finarelli. Hit your unmute button, Sharon.
Yeah, it's just hard to find because my mouse is on a different monitor than the camera is on. So it's one of those mornings. Good morning, everybody. Sorry for my technical difficulties. I'm Sharon Finarelli. I work as Director of Community Partnerships for Presbyterian Health Plan. And it's always exciting to see so many of our existing partners and potential partners in the room. I know that the only way we're going to improve health in New Mexico is by finding better ways to work together. And so I'm really happy to be invited to this initiative and look forward to learning together with all of you.
Great. Thanks, Sharon. Maureen.
Good morning, everybody. I'm Maureen with the Southwest Health Promotion Team for New Mexico Department of Health. I'm here in Otero County. Good to see you all today.
Great. And Elizabeth.
Hi guys, my name is Elizabeth Leninger. I am the community organizer for the Sierra County Behavioral Health and Wellness Collaborative here at the Olive Tree in Truth or Consequences, New Mexico.
And Eric.
Good morning, Eric Bransford with Doña County Health and Human Services.
Thank you, Eric. Let's see, Pamela.
Sorry, good morning. I'm Pam Wood and I am with Doña Ana County Health and Human Services as well. And I work with Eric, and mental health awareness is one of our many projects that we have here at the county, bringing awareness, so this is great to be here. Thank you.
Well, great to have you. And Brenda.
Hey, good morning. Brenda Alvarado here at the Department of Health Office of Border Health, based out of Las Cruces. And it's good to see everyone today. Thank you.
Great. It is great to see everybody. Could you just sign in again in our chat, and then Alex will be able to capture your name and information. Great. Did we miss anybody? Nope. Got everybody? Okay. Well, Joseph, would you like to attempt to give a brief description of this grant and what it is going to accomplish?
Absolutely. I'm going to give you the very, very short version. There's a lot of nuance to the grant. However, in one sense, it's very simple. We're just trying to increase awareness around behavioral health issues and struggles. The main way we do that is through training, and that's kind of the name of the grant, the MHAT. It stands for Mental Health Awareness Training. Our particular focus is in a 6-county area, However, because other people have this grant within that 6-county area, we want to make sure that it gets to the places that it might not normally get to, specifically rural areas, border communities, communities that engage with service, but might not always be the first people you think of when engaging in community service. So that is the main thing. We use 2 forms currently, 2 evidence-based practices. One is mental health first aid, and one that will be available later is CIT training. We're also looking to increase that with QPR. We actually have the ability to do it now, but we're trying to build out our mental health first aid first. Now, to support all of that, we also want to make sure that as we train people and they understand how to engage with best practices around mental health first aid and other modalities, that they're able to refer people. And that people can get to the place they need to get to get the care that they need based on these best practices. So the other thing that we're trying to accomplish, or at least get started, is making sure that there is a regional behavioral health referral network, so that as people are trained to encourage, and this is the way they phrase it in mental health first aid, to encourage appropriate professional help, that the barriers to entry for that are minimized. And so we've contracted with the Alliance to lead that process, and that's why they have brought you all here today. So thank you, everyone.
Great. Any quick questions for Joseph on the project?
This is Jen, just confirming, Joseph, I think you said CIP, you mean CPI training, is that right?
CTI.
Ah, okay, thank you.
Explain
Or
your acronym.
CIT, excuse me, crisis intervention training. There in Alamogordo, there are amazing people doing amazing work. They're actually nationally recognized for doing so. We just want to support wherever we can. We certainly aren't looking to compete with that. We can't compete with that. However, we do want to build capacity around that in other parts of the state that are harder to access that. So and then we're currently building that out. We haven't completed building that out. However, we have completed a lot of the steps that bring us to that competency. So that's in development. But right now we're currently training in mental health first aid in multiple areas.
And Maureen. Did you have any-
Thanks. Hi, everybody. Hi, Joseph. So I just want to share that Joseph and I met by phone and talked about it about a month ago. And yeah, we have a very robust CIT process here already. And so Joseph's going to actually meet with Jeanette, who oversees our CIT training program here. And so yeah, for Otero County, we're covered in that regard. But Joseph, I did have several folks interested in the mental health first aid. Particularly the first 2 spoke up were from NMSUA. And so I know you've been out of town and catching up on a lot of stuff, but I did email you those people. And so we definitely will participate in one way or the other here in Otero County. We don't need the support on CIT, but Joseph may actually reach out to Jeanette for some support. But we can certainly use the support for mental health first aid. So I just want to make sure Jen knows that Joseph and I have chatted, and it sounds like hopefully Joseph will come over and visit us at some point here and do the mental health first aid, and I'll help get that class full for you. So even if you set that up with NMSUA, if they have like 12 taking it and you want another 8, let me know and we'll get it filled up. So I appreciate you.
Great.
We'll make it happen.
Okay. And Roseanne.
Thanks, Wendy. Thanks, Joseph, for that brief overview. Can you please remind me of the 6-county service area?
Yes, it's Otero County, Hidalgo, Luna, Grant, Donna Anya, and Sierra. Thank you.
Thank you.
I'm having my second Monday, so I was a little slow to remembering all of them.
Jen, you had a question or comment?
Yes, and maybe there's an opportunity for discussion more later, but I'm also really listening hard for any training that is focused on reducing stigma around mental health awareness. We are starving for that within our provider population, actually.
So Jen, that is a great question. And one of the reasons why I really like mental health first aid is, especially in their latest revision, is they actually spend a lot of time on stigma. And that's interwoven, and it's pretty intense. It's an 8-hour course. But that's one of the primary focuses, really, aside from actually the action plan that anybody from any level of engagement can understand and be able to do. I think of it as like CPR for mental health. However, the other component, before they even get into all of that, they spend a lot of time talking about stigma, familiarizing people with the more common struggles in the United States around it. And as it continues through the curriculum, it continues to re-engage people with the stigma portion of it. So that is a huge part of it, and something that I'm very passionate about personally. So we make sure that we spend a lot of time on breaking down those barriers.
Great. Elijah.
Okay, this might be a loaded question, so I apologize if it can't be answered now. But does this training, in a sense, cover triggers in the sense of um, giving us the knowledge or the know-how, in a sense, to have those conversations regarding those triggers? Because um, one of the things that I'm working on is defining what a safe space is. And what we're talking about is, in a safe space, we're not going to avoid certain triggers. We're going to actually bring those conversations in that safe space so we can talk through those triggers, because the reality of those triggers is you're going to go be out in the real world, and those triggers are there. So I just question if we're going to be educated on how to navigate through those conversations.
Thanks for that, Elijah. I specialize in loaded questions. So thank you for that. This curriculum is really good at starting the conversation. Does it go as deep as one may need to go for triggers? No, it's more of an introductory. However, that is part of it, especially, for instance, like with the youth one in particular, because there's an adult curriculum and then there's a youth or for adults serving youth curriculum. And for example, when they talk about eating disorders, they talk about the things that, you probably shouldn't say or should stay away from. For example, does it go as deep as it could go? No, it's introductory. What I love about the curriculum is somebody from a behavioral health background that maybe actually works in behavioral health, and somebody just off the street that maybe is an electrician. They'll be able to walk away from this curriculum with something useful that they can use. And because of that design, it doesn't go as deep in something like that, because you might leave out your electrician, for instance. And so we want to make sure everybody's able to attend the party, so to speak. Yeah. So I hope that answered the question.
That's great. And let us, there are going to be a lot of, I think maybe, Joseph, we're going to need another session specifically on the training component. But it does occur to me that some of these are going to come up in the community conversation when we talk about barriers for people accessing services, because it's not just going to be that they're not there. It's not just going to be that they have too long a waiting list. It's going to be that some people are going to refuse services because they're worried about the stigma. So that'll come up, I'm sure, in our community conversations as a barrier we need to address. Valerie.
Yeah, I just wanted to make a quick comment. I took both the adult and youth mental health first aid training through CHI. Joseph taught it. And what I really liked about the curriculum is that it's structured in a way that you could really learn and understand. I love that you're provided with resources to look back on, and really a model and a plan to follow as you're you're moving along in these conversations. So that was really helpful for me, because I'm a very structured person and I like to have a plan to follow. So really useful.
Great. Well, thank you all. And this has really raised a couple of important connections here. You can see the connection from that intro training that is then going to help inform this referral network. Because as I said, it's more than just, oh, looking up a name on in a directory somewhere and say, how about if we refer you there? It's gonna, this regional, what did you call it? Regional Behavioral Health Referral Network is going to involve some ongoing training and conversations and relationship building and that sort of thing. So there's going to be some real connections between the training portion of this grant, which Joseph is heading up, and the resource and referral network, which our community conversations are going to help inform. The other thing I heard very strongly is we are going to build on what is already going on. We're not going to duplicate efforts. We're not going to step on anyone's toes. Hopefully we're going to build on. So is it Otero County is strong in certain components of this? Yes. Thank you for contributing that to the effort. Collaboration, building on, moving ahead together. So that's what we hope to do. And I mentioned to Mary too, who alerted us to the fact that there are conversations already happening in this area around resource and referral. We want to build on those. We don't want to cover ground that's already been covered. So what we're planning to do with these community conversations, let me share with you the initial thinking and see what you think. So we were thinking we would have 2 conversations to start with, 2 in-person conversations, one, for example, for Grant Hidalgo Luna, one for Sierra Otero Doña Ana. So 2 in-person conversations where we can really engage the community in exploring the possibility, the potential benefits of the barriers that we'll need to address in creating this regional behavioral health referral network. How can we connect people in our area, in our communities, to behavioral health services? So that's what we'd like to cover in these initial conversations. So this is a first round of conversations. We're going to take the information that we gather in these in-person conversations, compile them, and then bring them back to you in a third, probably online conversation, where we can take a look at what we've learned from the community conversations, really maybe dig in a little deeper, and then very importantly, talk about what we're going to do with this information. So it's got to translate into action, or we might as well not do it. One of the things we are going to do, though, is to share the information that we're gathering with other people who are very interested in answers to the same questions. So Sharon, not to put you on the spot here, but Sharon's let us know that she's going to be doing some community conversations around Presbyterian. Do you want to say a word about that, Sharon?
Sure, yeah. What we're looking for is focusing on population health specifically. We know we've identified some of the most vulnerable populations, like people who need perinatal care and aren't receiving it. Behavioral health, of course, justice involved. Native Americans, long-term services and supports, which may be people with disabilities or older adults. And so we're looking at partnering with community-based organizations to go deeper about what the needs are for those populations and how we could work together to meet them. We're modeling this after a Colorado program called the Ambassador Program, where we're looking at community-based organizations to help us to connect to the populations they serve. And hopefully that will help to deepen the relationship of that service organization with their client and with the health plan that serves them. Right now, we're in the hiring process for this, so it'll be a little while, but we again want to build on what's already there, not come in and have Presbyterian do our own thing, but hopefully meet the needs of the community by connecting with community-based organizations.
Great. And Elijah tells us that the Coalition in Homelessness is doing some conversations in the southern part of the state. So we want to connect with those and share our information with them, and they can share their information with us. And Sharon, Elijah, Chris, Jen, Jessica, many people on this screen are also members of the Social Determinants of Health Collaborative. So if you have Amy, you were at the last meeting too, I know. If you're not familiar with that, rest assured that we will be sharing this information with the Social Determinants of Health Collaborative and their membership, which includes many of the major actors in healthcare: Roadrunner Food Bank, Human Services Division, Department of Health. So one of the main goals of the Social Determinants of Health Collaborative is to, as best we can, find out what is happening in New Mexico, who is doing what, and what information is coming from the community that can help us, our state as a whole, craft a statewide infrastructure that can connect people with the services they need. So at our last meeting of the collaborative on last Friday, we heard someone say that they're very excited about the fact that this initiative, we've tried this many times in the past, but this time around, this seems to be happening in a time and space where there are resources available, there are collaborations happening. We may actually succeed this time. So I welcome all of you aboard this great adventure. And these community conversations are really an initial step in that gathering community information and making sure that it goes up to the state level and out to the rest of the state. So does that all make sense? How does that sound for what we're attempting to do here? So now we just have to make sure that these initial community conversations do the job. And so everyone goes away from it saying, yes, we contributed. We did not waste our time. We contributed important information. We're gonna follow this through and make sure that our voice informs what's happening around the state. So to that end, we have a few things we have to discuss. Well, let me pause there. Any comments, questions? Something we've forgotten, important to say? Or, okay, I'm seeing some, okay, great. So
Real
let me
quick,
just,
can
yeah.
I just because if I don't say it, I'm gonna beat myself up. But again, I just have to advocate for our care managers and our case managers.
Yes.
You know what I'm saying?
Yes, I
all
do.
this is in vain if we're not taking care of them. And my
Absolutely.
conversations are they're just burnt out. So just advocate for them.
Yes, sir. And our healthcare providers and a whole bunch of people on the front line are really showing the effects of the stress of the last, I don't know how many years, not just the epidemic, but so many years of underinvestment. So thank you, Elijah. So let me just real quickly pull up the agenda again, and you can see what it is we need to talk about. We won't be able to cover all this today, but maybe we can begin this conversation and then schedule some more meetings if you don't mind. We might want to have a couple of meetings, one meeting for the 3 counties in the Boot Heel, one set of conversations for the Otero Sierra Doña Ana conversation. But here's what we need to do first of all. What I'd like to do first of all is get a sense of when can we have these? How long should they last? And do we have some ideas about where we can hold these? If we get a date and time, we can send out a save the date card now, as long as we have another vital bit of information, which is an expanded invitation list. So if we can find a date and time, and perhaps a place, although that could be determined, but if we have a date and time, and we have at least an initial invitation list, we can send out a save the date announcement to folks, which can then be snowballed, and we can continue to send them out to more and more people to get a nice representative participation at our community conversations. And we're depending on you all in the community, health councils and Jen and all those of you who are working, local behavioral health collaboratives that are working in the community. You know who needs to be invited, so we're going to depend on you. And then we can talk a little bit about, okay, how are we going to facilitate, what questions are we going to ask, and what brand of facilitation are we going to use to really make most effective use of our time together. So how about if I start just very generally with the questions that we're thinking of asking, which in a very general, I'm going to stop sharing, which at the very general level are, I think what we want to know is, hang on, Chris, is how are you currently connecting people to resources? What are the challenges you are encountering? What are the successes that you want to note that we can build on? And then what are the recommendations that your community would like to make to the rest of the state about what needs to happen, what needs to be provided to people in the community so that we can in fact do our job of connecting people to resources. So that's it in a very general, at a very general level. Chris.
What I'd like to suggest, and I just want to mention to people that my background is really in health communication and also in social marketing. So I've done a fair amount, and I've spoken with, where is he? Joshua or Joseph about this already. Joseph, I guess. So I've done a lot of sort of audience research, but Wendy, I think in terms of asking the questions, and I don't know how the group feels about this, but it might be good to first think about who the different audiences are, because you've probably got some stakeholder groups. So for example, Elijah just mentioned, sort of on the health professional side, they may have some different issues in terms of, what you were just talking about in terms of the questions, how they connect, what they say is barriers or anything else, or what they would see a resource center being, as opposed to any of the community-based organizations themselves who are, going to be catching a lot of those referrals and everything. And then there's people themselves who
yes,
are going to be the patients. But I'm just thinking we can reframe the question slightly for different groups. And it may be that medical providers, if in a group of like patients, they may not say exactly what they feel like. So I'm just suggesting.
Okay, Chris, let me say one thing. This is an initial round of conversations. And so we're going to have one conversation that is going to be a mixed group of people. So yes, we need to think about the questions in terms of how a mixed group of people, if you want to call it that, can respond. I do want to point out that hopefully they're not going to be in opposition, but they are going to be finding areas of convergence. So point taken. And we can spend some more time. We will have to spend some more time honing the questions. So, but in terms of a general description of the information we want to capture, if you could just think about that for a minute while we go to Jen.
Thanks. A couple of things. I think I'm saying them at the right time. We've successfully conducted transportation stakeholders roundtable conversations here, at which we found it incredibly powerful to have the voice of the user and the voice of the delivery system in huge support of having them all in the same room at the same time. The patients should hear the challenges of providers and vice versa. So I'm hopeful that's the intention.
Jen, thank you so much. We are getting in touch with you very soon, because that's just the kind of experience. If you all have had similar experiences, we want to learn from what you have learned.
Yeah.
So Jen, we're going to get with you and find out how you made that work. Okay.
Sure, absolutely. And then I wonder if it does sound important to you that this happens in person. I advocate for that. But I would also throw out the idea that perhaps you can bring value to that conversation by also having some education or information. Maybe you have a speaker, some trauma informed, you know, lens sort of presentation. I'm thinking of a couple of different resources. In other words, maybe you have a keynote speaker who is also providing education, or one CEU of whatever, so that the draw includes that, if you're going to travel, in other words, that you're really making it worthwhile, so that there's not the inclination to say, well, can't we do that by Zoom?
Well, that's a good suggestion, Jen. Let's get together on that and let's talk with our community folks about what they think about that. I think it's important, though, we're going to have to balance the length of the session and prioritize what information we either want to give or receive. I think I've been thinking about the conversations more in terms of receiving information rather than providing information, but let's talk about that. And that could, in fact, perhaps be a prior or next step to the conversation. So I'm going to get with you very soon, Jen, and we'll talk some more about that. Any other, let's see, if you call it a summit instead of a conversation. Oh, Sharon, okay, well, we'll talk about that too, but does that imply like a half a day or a day?
Well, I'm just building on Jen's concern, because whichever county that meeting is held in, that means part of that county will be driving and 2 other counties will be driving. And so if you have to drive 3 hours for a 1 hour conversation versus 3 hours for something that adds value.
Oh yeah, 1 hour, I'm pretty sure is too soon. Let's hear from the folks that are going to be traveling. What do you think? Let's hear from the Grant Luna Hidalgo group. How long are people willing to travel for what investment of time? Could we hear from some of you, Mary, Valerie? Who else is Jen?
So I have some insight on this. So prior to working at CHI, I worked for the National Center for Frontier Communities for 8 years, specializing in rural and frontier communities. The reality is the further people have to drive, the less people are likely to attend, even if it's something very important to them, because odds are they are understaffed wherever they're working or wherever they're serving their communities. I think in rural and more remote communities, sometimes you have to do a trade-off balance. You have to weigh the pros and cons. Sometimes you will get more involvement if it's virtual. However, that will minimize the quality of the conversation. So I think prioritizing, if we want key people with quality conversation versus do we want a lot of representation, is an important conversation to have with that, because those are not easy variables to navigate unless you're independently wealthy, which I don't think any of us are. So that wasn't necessarily a solution, but I do think those are important things to hold in tension while you're making these decisions.
Great, thanks, Joseph. And Rebecca, I want to ask you again. Rebecca's our Alliance expert on mixed methods here. So I think there's been some progress made in terms of, what do we call it, a hybrid meeting? But would you recommend that, Rebecca, or not, based on our experience?
Yeah, I was actually going to bring that up. We do have, at the Alliance, we have those owls, which is like a meeting owl. It focuses on who's talking. And I think it's possible. I would love to hear what the communities think about that. I think key people that you want there, but maybe aren't willing to travel, would be willing to go through the hoops of a hybrid meeting. But I do think sometimes it can cause people to just not come in person, and then that can then lower the quality of the conversation, because it's possible for them to attend online, so they're not going to make the drive.
Let's again hear from the people in those communities, tell me what you think about the options here of in-person, Zoom, hybrid. Those of you that, especially those of you that may have to travel.
So I'll probably be someone that's traveling in this.
Okay.
So If I may, I would say that if it's of value to me and an importance of me, I will be there. I think even here at the coalition, we are having this conversation of in person and not. And I think at some point we have to have a hard conversation of this is the vision, this is the game plan, and being in person is what that includes. So I think we just have to do our part and have meetings that people want to be a part of, in a sense of they have to be a part of it because that's where they have to get that information, or whatever the case. So just building an environment that people want to be a part of will help that. But giving the people the option of Zoom and not, they're of course going to take Zoom because it's more comfortable that way and cheaper and all the above. So
Great.
accountability.
Great, thanks. And Jen, those are good comments. Your transportation stakeholder roundtables are hybrid. There are pluses and minuses to that format. Hang on to that because we want to hear about this. Your second question is, does the grant have room in it for stipends, Joseph? Is that
No.
something we need to discuss? No, we
No,
might have
we are not
some.
independently wealthy or
Yeah.
or grant rich or we're experiencing the New Mexico experience. That's
I
something
have
we
an
can all
idea.
relate to.
Yeah, I wonder if there are some people that do have funding, like Presbyterian, who might be in, or one of our other MCOs, who might be willing to put up some money for travel. Is that a possibility, Sharon? Not specifically PHS, but do you think the MCOs or someone like that might be willing to put in some money for travel?
I think part of it would depend on the turnaround time. If this is something that has a short lead time, it's going to be a lot harder to move than if you have a longer lead time. So I'm not sure what your target, dates are, but that when June?
Soon.
Oh, soon. Yeah.
This
So
summer.
the less lead time, the bigger the organization, the slower things move. Just so.
Okay. But we might explore that. Chris, did you still have your hand up or no?
Yeah.
Well, okay.
One or two things, just quickly on the money thing. Could any of the organizations or Joseph, even the CHI, probably everybody here has just applied to ConAlma for funding, but I was also wondering about that type of opportunity for money for this, or even to, unfortunately, I think it's finished, but the New Mexico Foundation was also offering to do some funding, I think, just recently. But one of the other things is, as we talk about virtual versus non-virtual, I would even beg to differ in some ways. I saw Jen's comment. Some of this, I think, really is going to depend on the skills of your facilitators in doing this work. So it's not just the questions or how people, come to this, but also the skill of the people dealing with that, both virtual and non-virtual. I also thought that Joseph's suggestion was interesting too, is if in the very beginning, instead of casting the broad net right in the beginning, if you try to focus in on maybe some other key gatekeepers or leaders in this to try and go through this, so they'd be smaller types of groups, but you'd still get that kind of information that could then serve as information for putting out to broader groups in the community afterwards. These are just suggestions.
Sure. How about, can we hear from the rest of the community, people that are that may have to travel? Would you be willing to do it in person, or what do you think about hybrid? What do you think about? I think Zoom is certainly not my option, my favorite, but can we hear from some other people that are apt to travel? Would you be willing to?
Yeah, this is Mary Mackey with Luna County, and I personally, on a personal basis, like the in-person thing, but I do understand that sometimes there are limitations, like Joseph mentioned, people are short-staffed. So I think that we should encourage people to attend, which we have done here in the community. We highly encourage you to attend in person, but if you are absolutely not able to, then there is that virtual option. The other thing, as far as the communities like Luna County, we've already started that conversation with an organization that's kind of like the hub of the community. So they brought all the invited the nonprofits to come in and say, okay, how can we collaborate? How can we bring these services together? How can we have a closed end referral system? And the only thing that we have found right now is, we're familiar with Share. But it's like, share is just basically information.
Directory.
that's there.
Mhm.
So we found Unite Us, and that kind of seems to be the platform right now that's already established. They're HIPAA compliant. It's just a matter of getting the buy-ins from the different organizations to get, to be a part of that system.
Right.
And that's the system that's in place right now.
Mary, who is the hub that you're using for your conversations?
Colores United.
Say that again.
Colores United.
And that
They're
is located where?
here in Deming.
In Deming.
Yes.
Okay. And you get people from what distance, shall we say?
With just for the community
The
right now.
local community.
Yeah.
Okay. Anybody else who's traveling?
I know that, I'm sorry, Phoebe, I know that we that we have a really tight schedule and a lot of our budgets are tight, just like everyone else. I like the option of attending virtually or hybrid. So sometimes I find that hybrid meetings are not as, I don't want to say not as productive. It's just difficult for everyone to participate that way. My personal preference is either virtual or in person. That's my personal preference.
Okay.
So that's my piece on that.
Okay, I can see a survey emerging here, an after meeting survey here, where we're going to poll you on some of these main questions. Like one of the questions is virtual, in-person, hybrid.
Actually, Wendy, why is it limited to just 2 groups? Is it possible for each of those 2 to do one virtually and one in
Budget,
person?
in a word, Chris,
But
budget.
the virtual may not cost as
Chris,
much.
we'll talk, can we, let's, oh,
Sure.
okay, sorry.
I'm asking the question. That's
Yeah, it's budget and timing. Budget and timing. So we have a real tight timeline. We have a very frugal budget. So
And
we're
what-
planning, and as I said, this is an initial round of conversations. It's not more than, it is guaranteed that this will be passed on to another organization that has additional resources that can build on what we are doing. What is the timeline we're working with, Jen? Yes, the summertime. So if we can have these conversations, we were hoping July, certainly August. So is that possible, folks, to put together 2 conversations in July or August? What do y'all think? That's another survey question perhaps, but let me hear what you're thinking.
Miss Wendy, I just want to say it's 10:50, so
Right.
just giving you the reminder.
Thank you, Joe. Thank you, Alex. July, August timeline. Responses?
I say it's possible.
Elizabeth, thank you. Anybody else?
Yeah, I would say it's totally possible, in person, hybrid, or either or.
Okay, great.
I think you
Wendy,
just
I
make them
did,
work.
sorry, Wendy, I did
Huh?
want to make a comment though, for those that are traveling long distances, if we do an in-person, I think not an hour meeting would be beneficial. I think it should be 2 to 3 hours and take
Yeah.
advantage of that time that we have together.
Exactly. I was thinking either a morning or an afternoon, but perhaps not all day. Mary, what do you think? Or whatever, what are you thinking?
Yeah, I totally agree. I'm thinking probably more like August because, July, everybody's getting into the new fiscal year and stuff like that, but maybe towards the end of July, beginning of August.
Okay, and let's try to do it before school starts, perhaps. Okay, how about end of July, beginning of August? We'll send that out on our follow-up survey too. So Alex reminded me that we don't have a lot of time left. Let's raise some more questions that we need to discuss, and then we can talk now, or I can put it in the survey that's going out to everyone about a next meeting date.
Wendy, I'm just wondering, maybe this isn't possible, but I'm wondering if there is any existing meeting that we could build on. So for example, if there was a health council meeting happening in one of those counties and it was possible to include other counties and build on what was already there, then we would have a core group already there. It may not be possible, but I'm just thinking instead of adding one more meeting, if it's possible to build on what's already there, that might be an advantage for everyone.
The magic word, Sharon, build on what is already there. So if anybody, any of the health councils are interested in that, or any of the others of you, a local behavioral collaborative, Rose, is Rose still with us? Yes, Rose. Those of you that have regularly scheduled meetings in July and August, could you let us know if that's a possibility?
Maybe it's even extending like part of their meeting. I don't know. It could be a flex thing. I'm just thinking, that you already have a core who has bought into the conversation and the value of it, if we can do that.
Yeah. Okay. What do you think? We've got several health councils represented here. We've got a local behavioral health collaborative here. We've got 100%. If anybody's having a meeting in July or August, could you let us know? We'll put that on the survey. Alex, we're going to be busy crafting this survey, right? Next steps. How do we proceed from here? You see all the topic of, we made some progress. We're thinking late July, early August. We're thinking 2 to 3 hours, morning, afternoon, perhaps. We're talking about virtual, hybrid, in person. And just Rebecca, to remind us again, how do you feel about the possibility of hybrid? Would you recommend it again or not?
I feel like I know it was a little bit different, but we had pretty good feedback from our statewide health council meeting being hybrid. It seemed like people online felt that they were engaged and people in person felt like they were engaging online. So I think if it seems like the communities want to make sure that they're opening the options to everyone, I would say it would work.
Okay, and we do have, the Alliance does have, I guess, the latest equipment, this OWL system that we, of course, can use. Jessica, I saw your hand go up and down.
Wendy, just to clarify, I just had a thumbs up, but if you're asking me to just give a brief comment, I'm definitely a believer in hybrid meetings, so that it can be inclusive based on people's availability and timing. As a person who works with the healthcare side of things at Roadrunner Food Bank, I know a lot of people rather prefer to meet online. And I just have found that works well. And to Rebecca's point, I attended the statewide conference in February and was online, and I found that as engaging. I just am more of a hybrid person, opening up options for everybody based on what they can and cannot do.
Okay, great. What other questions then do you want us to ask of our planning team here in this survey that's coming out after? So dates, whether or not people have established meetings that they're willing to build upon, perhaps by extension, virtual.
Wendy,
yes.
You might ask if any of the organizations here have a hosting location available.
Yes, I would like to ask if you have a hosting location available. And where it is. And where, if we think about this in 2 districts, Hidalgo Luna Grant, Otero Sierra, Las Cruces, where would be the optimal, perhaps, meeting place for those triumvirates, those 3 counties? So let's think about that too. We'll have that on the list too. Anything else that you would like us to follow up on in this post-meeting survey so we can get some more information? If you can't think of it now, let me know. Put my address in the chat, although you should all have it in the email invite. What about a next meeting? How often are you willing to meet between now and the end of July? Thank you, Sharon. Can we have a couple more meetings? Are you willing to meet weekly? Bi-weekly? Should we put that in the survey?
I'm available for whatever time you need. You need.
Community folks, Elizabeth, are you?
I think weekly is too much just
Too much?
because I only work Monday, Tuesday, Wednesday.
Okay.
And trying to do everything that I need to do and have a weekly meeting, I think would just be
too much.
too overwhelming for myself.
How about this? Thank you, Jen. Thank you, Jen. I'm getting in touch with you very soon, Jen. Actually, Rebecca, you and I should talk to Jen about her hybrid. Or was that Elizabeth? Who did the hybrid?
It was Jen.
It was Jen. What were we just saying? Sorry.
Bi-weekly?
Oh, bi-weekly. How about we do as much as we can by email? So we meet again perhaps in 2 weeks. We get a lot of information via email with all of you and phone conversations with all of you. We come back in 2 weeks. How does that sound? Is this a good date time for people to meet?
That works, yeah.
Okay,
Before lunch would be best for me.
Before
I don't know
lunch?
about everyone else.
okay, before lunch on a Tuesday, not a Monday? Okay. Joseph, what do you think? Yeah, okay. All right, so how about this? We will, first of all, thank you so much. This is just really rich conversation and lots of great information. I'm so happy to hear there's so much happening already that we can build on. So Mary, we're definitely going to get in touch with you. Jen, Elizabeth, Maureen, I think I heard something that we need to get in touch with you about, but we'll put together a survey with some questions and feel free to add information if we've forgotten to ask an important question. We'll have that out to you. Just Alex, what do you think? Can we get that out by the end of the week? Do you think it's Tuesday? I think we can. Did we ready that? Yes.
Yes, and I just sent you the email of the stuff in the chat as well. So you should be getting them, Miss Wendy. And then I took some notes, so I'll organize it and send it to you as well.
Okay, great. And we have, this meeting was recorded, so we can share it with the other folks that were not able to attend. Well, we've got 1 minute left. Does anybody have anything to Maureen? Nothing to get in touch with me about? Just that Joseph's setting up training. Good meeting. Okay, meeting every other week sounds good. Okay, a lot of people had to jump off. Okay, for those of you remaining.
Can we get a list or like who's got the grant, like in our community? Because I'm
Who's
not
got
really-
which grant?
the grant. This is part of a grant, right?
This is a CHI grant and it is to the Center for Health Innovation, and it covers Grant, Hidalgo, Luna, Sierra, Otero, and Doña Ana counties. Okay, anything else that anyone needs to know or wants to suggest before we
I'm biased. So I'm in Silver City, full disclosure, but Hidalgo is about an hour's drive south. And then Mary Mackey over in Deming, that's about another hour. So like if they wanted to converge, but then that would put preference to Grant County, but for what it's
well, Hidalgo's right there in the intersection, is it not? Of the two counties. It occurred to me that it's right there. So
I'm bad at maps, so I believe you.
Yes, yes. So again, if we can find a host site in a centrally located, easily accessible location, that'd be great.
Deming would be more central, would it not? Thank you, Mary. I'm like, no, Hidalgo is not central to Grant.
What's the one in the, we'll take a look at a map. And Maureen, I think you said when I talked to you that you thought Sierra might be willing to travel, for example, to Doña Ana.
I don't remember us talking about that, but I doubt that Sierra would be willing to travel to Alamogordo. That's pretty far.
Okay.
I don't
So
remember
that's-
having that conversation with you.
Great.
But I don't think Alamogordo will travel to Sierra, and I don't think Sierra will travel to Alamogordo.
Good to know. Okay.
Okay,
so
thanks.
That's going to be on the survey.
Real quickly, I do have a request or a question.
Yes, Pam.
Would you be willing to share at least the scope of work of the grant with
yes.
us so that we could have a
Yes.
little more idea of what's involved and
Yes, we will do that.
outcomes.
Uh-huh.
Okay.
And someone else asked about the general questions for the conversation, and we'll include that also.
Okay, thank you.
Okay, any other bits of information that people would like us to include? Again, thank you so much. We are in a tight timeline. We are on a frugal budget, but remember, this is just the initial foray. Not the initial. This is just one more small step in the direction of getting community input into the larger conversation. So we won't be able to do everything for everybody, but we're going to do our best with your help. So thank you all. We will be in touch with many of you. Joseph, can you stay online for a minute?
Thank you, guys. Have a great day.